So one of the biggest topics in 3D imaging today is radiation and dose. And many ask how Planmeca Ultra Low Dose is different than all the rest. Hi, I'm Brent Garvin, and in this Be Informed e-learning video, we will discuss what low-dose 3D imaging is all about, including the differences between low dose and Planmeca Ultra Low Dose. So everyone that has a CBCT unit says they have low dose. The first thing I'll ask you to do is make sure you are informed and have the manufacturer rep explain how they handle low dose and make sure they show you images comparing them. Don't just take their word for it. So in order to arm yourself to make an informed decision, I want to help you better understand the differences between low dose and then Planmeca's ultra low dose. So low dose is simple. It's found on most, if not all, 3D units today. It was actually a result of the negative press these high-dose machines were getting in the public sector, so they of course had to react. So they created these low-dose protocols to address the concerns about radiation. But in order to understand the problem, let me first explain how they work for the most part. When a cone beam travels around the patient, it takes somewhere around 12 or 14 seconds to capture the images it needs to make the 3D image. So during that time, the tube head pulsates and the sensor captures about 400 frames as it goes around, kind of like building the image you see here. So to achieve low dose, manufacturers have sped up their scan times and they do these quick or fast scans. When they take these quick scans, they travel around the patient's head so much faster, let's say like 4 seconds. But here's the problem. Fast scans create noise in the image, and even more importantly, it's traveling around so quick it doesn't have the time to take the same 400 frames that it normally does. So they end up only taking somewhere around 200 frames, for example. So what's the big problem with that? Well, as you can see, less frames equals less details, and studies have shown that these dose reductions are accompanied by a significant loss in image quality. So as you can see, taking low-dose images is easy. Maintaining the image quality, well, that's the hard part. But this is where Planmeca's ultra-low dose comes in. So here's how it works. When Planmeca takes its same 4-second scan, for example, it can rapid fire its tube head and still take the same 400 frames that it needs to make a high-quality 3D image. So more frames equals more details, resulting in better image quality. In fact, one major study out of UNC by Dr. John Ludlow, who many refer to as the godfather of dental radiation, proved to the industry that Planmeca's ultra-low dose and Planmeca CBCT units showed a nearly 80% reduction in radiation without sacrificing image quality. So you can't tell the difference between Planmeca ultra-low dose and a normal scan. In fact, check out these images. Diagnostically, you can't tell the difference. What's cool is you can take any size image at any resolution and any voxel size with no restrictions. This is a game changer. So if you want to take a normal res scan, you can take it at low dose. If you want to take a high res scan, you can take it at low dose. And what's really cool is Planmeca has successfully driven down radiation levels to be lower or equal to digital intraoral, so clinicians can now take 3D periapicals instead of a 2D periapical and completely change how they diagnose from the start. But we'll save that topic for another video. So let's recap. Low-dose images take less frames, which equals less details, resulting in poor image quality. Planmeca Ultra Low Dose takes more frames, which equals more details, providing the same diagnostic quality as a normal scan. And remember, when talking with a manufacturer rep about 3D and low-dose imaging, we've showed you ours, so make sure they show you theirs. It's only fair. And do yourself a favor, just be informed. So if you enjoyed this e-learning video, please take the time to hit the like button and also subscribe to my Facebook channel to learn of the new videos as they become available. And also, if you have any requests for future topics that you think would be valuable, please let me know in the comment section below. Thanks for watching.